Today is May 14th, 2024. I'm Cameron Wood here at the Ohio History Connection in Columbus, Ohio. We're here today with Nina Lewis to talk about her AIDS advocacy. Nina, can you please say and spell your name for us?
Yes, Ninalewis.
Thank you. Where and when were you born?
I was born in Cleveland on the 21st of July, 1953.
Did you grow up in Cleveland?
No, I did not. I was born there, but I was raised in Youngstown, Ohio.
What was it like growing up in Youngstown, Ohio?
It was a very diverse neighborhood. Most of the people were laborers, and they made good salaries. There was a lot of steel mill work. My stepfather was a train engineer who worked for the sheet and tube, and lots of people around me, their fathers, all the fathers worked. The mothers didn't, not so much. And the neighborhood and the schools that I went to were very diverse. As time went on, they were less and less diverse, and more prominent people of color began to be who was going to the schools that we were assigned to. And so I grew up with first a very Eastern European mix of friends. People had a lot of children. The household across the street from me had 12 children. 2 doors down, it was 9 children. I had a very close friendship with a Puerto Rican family, and they had 17 children. Lots and lots of diversity. But as time wore on, and as I learned later when I was in college, there was a great migration. And I lived that. And by the time I graduated from high school, there was definitely a prominence of African American students and Puerto Rican and Mexican students. And the minority was definitely the students that were Caucasian. And that was fine with me because I knew them all. We grew up together and I knew them all, and it made for a very colorful experience as a child and as a teenager.
Was your stepfather still working for Youngstown Sheet and Tube when it started to close?
No, he wasn't. He was a World War II veteran, and he came, and he was very damaged in the war. He was bombed. He was driving a train, and he was bombed in Belgium, and he broke his back. And he was lucky. He saved somebody, but he was lucky he lived, and he was in the hospital for at least 2 years in a number of locations. And he came home a worn out man. And he started to have strokes in the late 60s, and he was not well. So he stopped working, obviously. So I don't know if his health was so challenged. I'm not sure he was fully aware how things had drastically changed.
Was he set to retire at that time, or did your mother have to go to work?
Because of the circumstance that they had, my mother really never worked. We didn't have a car. He didn't. My mother never drove. And I think he had some disability. They weren't consulting with me about their income, but I do believe that they had some money because of his disability. And when I went to college, I received money as a result of his Social Security. So my mother really never went to work.
So where did you attend college at?
I managed to get myself to Ohio State. I had nobody in our family ever went to college. I knew even as a child I would probably go to college. I just knew I was different than the rest of the family, and indeed I am. And as a result, I went to the librarians. I was very close. I've been a bookworm all my life, and I like to read, and I still like to read, and I'm retired now, so I really like to read. There's lots and lots of books at my house, and I like to use the library. And so I had relationships with the librarians in our neighborhood, and I had them help me fill out the paperwork. I went to my guidance counselor at our school, and she informed me in no uncertain terms that I was not college material and I should learn to type. Well, that was not helpful. So I just ignored her, and I just did what I knew I could do. And at this point in my life, I have not one but 2 degrees from Ohio State. And I taught for them for 20 years always as a part-time job.
So Youngstown at the time was very diverse. What was it like coming from Youngstown to Columbus? What was that experience like for you?
Well, honestly, I have to say that from the moment I stepped foot on campus, I absolutely loved it. I'm a pretty big extrovert. I was thrilled to meet so many different kinds of people. I made lifelong relationships. I have a group of friends that we've been close for 53 years. And I expect that we'll be friends and close until we all die. I was so grateful that I got the opportunity to go there. It took me 30 years, but I paid off all the loans I took out. I got a lot of assistance, most people did. And because of the time that I went, one of the more interesting experiences was myself and another woman that I grew up with both got into Ohio State. So we came down together, and we were initially roommates, but it didn't last very long, only 1 quarter. And she had other things in mind that I did not have in mind. So she moved across the hall, and that was fine with me. But the day we moved into our dorm, we had notices in our mailbox to go to a meeting that was a special orientation, and it was called the Freshman Foundation. And so we lived pretty close. We were living in a dorm, Taylor Tower, which is the north end of campus. And it was at the Stillman Hall, which is a social work building. So we were close. So we walked down College Avenue on the day, and we went there. And we walked into the room, and it was almost all African-American students, a couple hundred, and us. And I learned later, as a result of that meeting, that I do believe that they recruited people to come to Columbus from central cities and under achieving and under and schools that had people in it that might not have been especially prepared to go to college. And I think that they were trying to give us the best chance possible, and special assistance, etc. But we looked at each other like, okay, this is like high school, and we sat down, and it was fine. And I don't think she ever needed any assistance. I did. I definitely needed some different kinds of refocus, because I was extremely overstimulated, and I really liked it. And I believe that the whole experience wasn't just academics for me. It was the whole experience. And so that interfered a lot of completing my degree, but I did complete it, and then I worked 10 years, and then I went back to graduate school. I liked college. I did. it meant everything to me. Now, when I started teaching for Ohio State as a part-time job, and they came to me, I was very, very grateful. And I'm I wear a ring on my right hand that's my class ring, and never take it off. And Ohio State means a lot to me.
At the time you were there, did they have I know the Gay Activist Alliance started in the late 60s? Early 70s?
I can remember the woman's name, actually. I was a sociology major, and so there were people that some of the professors had come. And I was in a seminar at one point near the end of the time I was in undergraduate school, and a woman came that was representing that group. And it was interesting. And I had a very close gay male friend. And so I asked him if he wanted to come with me, because there were only probably 10 of us in there. And I thought he'd think it was interesting, and he did. And we enjoyed the experience very much. But that's the only time I ever encountered anybody that was so public about their life. I think that came just past the time when I graduated. I graduated in 76, and I think it was closer to the 1980 when things started to percolate a lot more. Of course, the Gay Pride Parade started, and once that happened, and the marches, once that happened, things pretty much got interesting. And people started to name who they were and accept and work out how to be honest with themselves and find support and friends.
Were you out when you came to Columbus?
No. Oh, no. In fact, the gentleman that I told you about, he actually died in 1994 of AIDS, and I was his one of his primary caregivers the last 2 weeks of his life, and I was also his power of attorney, and I arranged his funeral and had his memorial at my house. And so he went with me to this woman's presentation that I just told you about, and he said, "You want to go and have some beer?" I'm like, "Sure." So we went across the street to High Street, and he said, "Hey, I'd like to play a little game with you." I go, "Okay, Russell, let's do that." He goes, "I'm going to ask you questions, and I want you to answer just yes or no." So I think, and he said there were 20. I'm like, "Okay." So he started asking me questions. And we were still drinking 3-2 beer. So, the first question was something like, "Do you have more female friends or male friends?" And I said, the answer to that. I have a lot of both, many both. Okay. The second question. Do you prefer your female friends? I go, "Not necessarily, but I certainly value them." That's not a yes and no answer. I'm like, "Okay, I probably do have more female friends." He goes, "Oh, okay." He goes, "Did you have a lot of female friends in high school?" I go, "Yes." "Did you ever have a boyfriend in high school?" "No." And he continued down this line of questioning, and we were continuing to drink 3-2 beer. And eventually we got to question 15, and I'm like, "Oh my God, I'm gay." And that's how I found out I was gay. I had no insight into it at all, not at all. And he just laughed and laughed, because he knew long before I did. I wasn't acting on any of that. I didn't have any overt feelings that I could name. It never occurred to me. I just didn't think like that. But once it was named, things started to happen. I started paying a little more attention, and I started perceiving a lot of things around me that I wouldn't have perceived before. And one thing led to another, and I started having more female friends in my life.
How old were you when your friend questioned you and you had this realization?
Maybe 21, 20 or 21. I had to be 20 because we were still drinking 3-2 beer.
So 20 years old, so big discovery to make at that time.
It was. It didn't upset me or freak me out or anything. I just accepted it. Oh, and because I had a most unusual family, that summer when I went, I always stayed in Columbus. I rarely went to Youngstown, and when I did, I didn't go around my family much. But I did see my mother that summer, and I told her, I go, Mom, I need to tell you something. And she goes, okay. We were outside sitting on the porch. I go, Mom, I'm gay. She goes, oh, I knew that. Oh, well, why didn't you tell me? And she goes, I knew you'd figure it out eventually. And I'm like, and I can tell you every single one of the female friends that you felt strongly towards. And the first person she named was somebody that lived across the street from me, and I was heartbroken when they moved. They moved as part of the Great Migration to the suburbs, and I was inconsolable because we were close. And I think I was in 7th grade, 6th or 7th grade. But my mother, when I told my mother, and then she said, well, now that that's on the table, would you be interested in going somewhere with me later? I go, I don't know, like where? Because we weren't really close. She goes, well, upstairs, because by then they already lost the house that they'd lived in, and she was living in an apartment on the first floor, and there was somebody that lived above her. She goes, the guy that lives upstairs is a drag queen, and he's performing tonight. You want to go? I'm like, not with you. No, I don't want to go. And I never went to a drag show with my mother, but she wanted me to, and I'm just like, that was a big surprise. Mm-hmm. It was a big surprise, but I shouldn't have been surprised. My mother was, in the old days, they called it fast. And we'll just leave it at that. Mm.
What was your introduction to the community like in either Columbus or Youngstown?
I mean, I had no introduction to the community in Youngstown. Over the years, in the late 70s, early 80s, when I was in Youngstown, I went to one or two gay bars, but it was dreadful. And they were in locations where I'd gone with my parents when they were out to have drinks. And I'd look around, I'm like, this is weird. Because I had only been in there with my parents when I was a child. So I didn't like that. It's just like probably a lot of other gay women in the 70s, even in college. I was in a sociology class and we had to do small group work, and we got assigned to the groups, and one of the people in my group said, well, why don't we do participant observation? I go, okay, that'd be a good idea. She goes, let's go to the gay women's bar. I go, where's that? And she knew where it was, and so we went there. And we were, there were 4 of us, and I think me and another woman had never been in that environment before. And this was before I had my own personal revelation. And so we just walked in there. I wasn't concerned about it, but it was a very different environment. It was the Summit Station. It was Jack's A Go-Go. And so as time went on, we those of us that had begun to be aware of who we were and wanted to build a community in any way, we went there a lot. because it was small, and we knew the bartenders, and it was just a comfortable place to be. And if we wanted to dance, we could, and it wasn't any big deal. And then, of course, as the years went on, we had some very, very big gay bars in Columbus, large. And men and women went there. And, of course, I went to all of those bars. And I preferred often to go out with gay men. I used to like to hang with the boys. And it was like, I felt like I came out with the boys, actually. And it was fun. It was lots of fun. And then it wasn't, as the 80s marched forward.
Why was that?
Because many of them were dying of AIDS. And I had a number of people in my life that two hairdressers died. And they were so sick, and nobody knew what it was, and the whole gay men's community was just scared to death, and with good reason. They'd get sick, and 2 months later they were dead, and they looked like the peak of health when I knew them. So it wasn't so much fun then after a while. And then as time went on, I participated in the gay social environment in new and different ways. I went to a number of, I think they were called consciousness raising groups at the time, and it was all women, and it was a lot of feminists, and a lot of them were also gay, and that was a different way to spend time and not just go to bars. And then eventually we had really nice gay restaurants that were gay owned, and they were a nice place to go for an evening meal and to go out someplace nice on the weekend. There were two downtown for sure that I used to go to quite a bit, and one of them changed hands a number of times. But lots of my friends went there, men and women. So, because I considered myself coming out with the gay men, and I spent so much time with them and had so much fun with them. It was the disco era, and it was fun. Oh my God, it was fun. It hit a number of us really hard when they started to be so sick, and one at a time they just started dying. It was dreadful.
Do you remember your first realizing something was going on? Maybe you didn't know it was AIDS or hadn't heard the words or something, but knew something was happening.
The news. It was the news, and I have to give it was mostly men. ACT UP, I have to give them a lot of credit because they raised holy hell all over the United States, and we had our fair share of activities in Columbus as well. And then of course we started to speak up during the marches. I mean, I went to the National Gay Pride march in D.C., and almost everybody I knew also went. We had an enormous amount of people there from Ohio and from Columbus, and that I went there twice actually, and we had our own things in Ohio. It wasn't originally meant to be a big parade. It was a protest march, and there was other things that happened. A lot of gay women were involved in anti-pornography work, and we had marches for that too. And I was involved. I went to those. I participated in those, and I was glad to participate.
What got you first actively involved in AIDS activism?
Well, aside from participating in the marches, which there was a lot of people that were verbally very, very aggressive, and we just, strength in numbers, and we just ignored them. But there was a level of danger that was present. I never focused on it. Bring it. That was my view. And it created a lot of solidarity, and I certainly like that. But honestly, I worked in the domestic violence movement for 10 years, and I had a college roommate who's also gay, and we're very good friends. And she worked for the state of Ohio. She worked for the HIV/AIDS program at the state Department of Health. And they had money that suddenly became available because of the passage of the Ryan White Care Act. And and she was working for the part of this health department that was intended to manage that money and assure that community-based services were provided. There were no instructions on how to do that. There were and people all over the country, the states that got that money, they all did it a little differently, and so she was responsible for that as part of her job. And she called me, and I'd been in DV work for 10 years, and she said, "It's time for you to do something else." I go, "What do you mean?" She goes, "I want to hire you as a consultant, as a public health consultant." I go, "What?" She always worked for public health, and I never did. I wasn't interested in doing state. I didn't want to work for government. I just didn't. I thought I needed to be closer to the ground where things happened and people were. It gave me the chance to do direct service with people that needed help and needed some guidance on how to advocate for themselves and to know about resources. So I was very reluctant, but she started talking about money, and then because she doubled my salary. Now, of course, there was no benefits. Well, who cares? I didn't care about that. I'd never been really sick, and I'm like, oh, that'll be fine. So I said yes, and as a result, she and I and another nurse worked together, and we crafted a structure or a process to be able to properly distribute funds to be able to provide the best help and support possible for people that were infected with HIV. Honestly, I'm very proud of that work. That program is still running. And that was a long time. That was 1990. That program is still running. I worked for her for about 2.5 years. She left the health department and moved to Boston and went to Harvard and got a degree in, I think, public administration. And the other woman who was a nurse, we lost track of her. We don't know what I'm sure she's retired by now. But that was very good work. And honestly, I came up with my own idea because I needed to collect information to find out what actually was happening in the state of Ohio. And I had a pretty cheap car at the time, and I ended up in the 2 years' time putting so many miles on my car, I had to get a new car. Because I had a list of all the health departments, because that's the system that was in place at that time, how to distribute funds for services in public health. It went to the big 8 cities in Ohio. And so as a result of that, I knew to start there. But I started asking a lot of questions, a lot of people, and I got a long list of people in each one of those 8 cities that were likely to be involved in doing work, either as a part of a group that did volunteer work or money they got from a foundation. people on their own in every one of those 8 cities emerged to provide help. And so I made a list. I started doing cold calls, and I went to every one of those 8 cities. I built a lot of relationships with a lot of people that were involved in the work, many of whom had much more experience than I did. But I learned, I absolutely learned, and as a result, I was able then to see what would be the most consistent way of providing service. In one city, the money went to the city health department, and they had a credentialed social worker, but she worked in a high-rise building, and I'm like, excuse me. And there was a and I liked her. I went out to lunch with her a lot of times. I met with her a lot of times. But there was another group in that community that was the leadership was provided by nuns, and they had they named their program No One's Victory Alone. It was known as NOVA. And they provided an enormous amount of services. And I don't know where they got their money. I think I think as other communities I would discover later, the drag queens, and there were lots of them then, they did a lot of fundraisers, and they gave the money to the people that were doing the work to help gay men, basically, who, it was spread to other people as time went on, but it was mostly gay men at the beginning, at least in Ohio. All different backgrounds, too. It didn't matter if you were making a good salary and had insurance and had nice clothes and had been college educated, or if you were a bartender. It didn't matter. Once you were infected, everybody was the same. And there were people that got kicked out of their houses, their families disowned them. And I'm sure you've heard these stories before, and it was absolutely true. And eventually, the gay community just started getting organized and allies, and there were a lot of allies, like these nuns, and they were, I can picture some of those nuns to this day. And so we weren't funding them. The Ohio Health Department was not funding them. We were funding the health department, and it was their job to distribute the money. Well, some of them kept it. They just kept it. It's like, and they did what they thought was right. They probably testing a lot of, because testing is still very important. But how's that helping somebody that got kicked out, who's sick as all get out, who has no money for medicine, doesn't have an infectious disease doctor, wouldn't know how to make an appointment? That didn't help them. They needed no transportation, no way to keep their clothes clean. I mean, are you kidding me? So, the three of us that were structured that program knew that we had to have quality, consistent, community-based staff doing that work, and we had to create a format for them to do that work. And that format in government is to create what's known as an RFP, a request for proposal, because originally the money had been received by the state of Ohio in the spring, late winter, spring of 1990. And I do believe that money was on us. I don't remember what it's called. I think it's just a grant year. It was on a grant year that was specific. So I think the money came, and we had 3 months to spend it. Like, if you don't spend the money, that impacts how much future money will be given. So we had to hustle to figure out what we were going to do. So that was helpful, and we spent it as best we can. And I don't remember, because my colleague was in charge of that. I I was really trying to be a foot soldier in the community, the whole state, to figure out what got put in place once they farmed it out to all the health departments, which is proper, and but they all did something different, and I had to find out what they all did. And then we were getting calls endlessly from people that lived in small towns, in rural areas, because Ohio is very, very rural. And of course, as a result of the stigma and the fear that people had, in the 80s, because of disco and because of the beginnings of the gay pride community, a lot of people moved to San Francisco. A lot of people moved to Dallas and to New York, and Boston. They wanted out of here, and I could understand why. And then they got sick, and then all their friends got sick. So many of those men came home to die. And they lived in rural areas. So their family members were frantic. And they'd call the state health department, and we got a lot of those calls, and we helped them as best we could. And then after people came home, they died. And I know my supervisor, my friend from college that hired me, she went to I don't know how many small towns, because none of the undertakers, none of the funeral homes would provide services. And she had to go there and represent the state of Ohio and say, you will provide these services. I mean, they're licensed. All these programs and services were licensed. If you have that credential, you are going to provide that service. And so we had a lot of things that came up that nobody had any resources or answers for. We had to figure it out, and we did. And some communities, the Columbus AIDS Task Force, and I couldn't speak about their funding. I know eventually we funded them. They certainly got the Ryan White Care money, but they needed so much more money than they got, and there was lots of fundraisers. There's a very big fundraiser that eventually happened, and it's been happening since almost the beginning, and Gloria knows more about that than I do. The Art for Life is a big auction and a big event. And so they did their own fundraising, and the gay community had endless drag shows, and they gave all the money, almost all of it, to community-based organizations, mostly CATF, but also Pater Noster House, and I think Project Open Hand, trying to make sure people had groceries and had a hot meal, and when they knocked on the door. And an event, there was a monthly luncheon and holiday events that were nice holiday events. There was a lot of work that got done, and they didn't have any funding. I mean, there wasn't any. So as time went on, that spread out. That started to spread out. But initially, they had to find their own money. So after the Ryan White Care Act really got underway, I changed jobs. My colleague didn't want me to change jobs. She offered to add me as a civil servant, and I didn't want to do that. So I moved on.
Well, we had talked just a little bit before we started about Barb Cordle and Pater Noster House. What was your first experience? You mentioned meeting Barb before
Yes.
Pater Noster House. What was your first experience with Barb?
Well, when I was working, I moved on from the state health department to Lutheran Social Services, and they had gotten a federal grant, and they were looking for a leadership to implement it and to manage, to hire and train and monitor and manage staff to assure that people, families, it was families who'd been homeless. I think most of them had done time in shelters and certainly couch surfing. But then we had a federal program in this country that was funded by HUD. And the initials were SAFAH. I don't remember exactly what it stood for, and it was just easier to refer to it as SAFA. So they hired me to do that. And as a reason, the people that it was intended to serve were people that not only had been in shelters and had many challenges in their life, but also people who had moved on to something that was available at that time that was also funded by HUD. And it was called transitional housing. And there were specific criterion for that, but the ultimate bottom line is that was an intermediate step towards housing affordability and stability. It was an intermediate step. I'm not quite sure if that exists now. A lot of things have morphed in the housing community because there's a lot of public outcry and awareness of how much homelessness and family homelessness that has happened over the last 40 years. But at that time, that was a big deal. And so who was eligible for the SAFA program were families that were nearing the end of the time that they were permitted to be in transitional housing, and it was 18 to 24 months is the framework for that. So there were referrals made to my program, and my staff would meet with them. And initially, the way the system worked, we utilized a model that I learned about and my staff learned about called the family development model. And it was originally from Iowa, and it was intended, who was intended to serve were people in Iowa. The University of in Iowa was a big part of developing this. Why? Because at the beginning of the presidency of Ronald Reagan, a lot of money was shifted away from farm subsidies, and people that were in agricultural work in Iowa were not accustomed to seeking social services. They were pretty self-sufficient, and they needed support and help, and it wasn't going to be like it is in central cities. That just wasn't. They were used to taking care of themselves and their own, but it was getting harder and harder. So the University of Iowa worked with that community, and so many of the principles were wonderful. It comes down to treating people with dignity and treating people like intelligent humans that can, if given the tools and the information, can make good decisions for themselves, and treating every member of the family as an important component of the family. So that's what SAFA was about. It was based on the family development model that came out of Iowa. So one of the things that was an element of that model was beginning to small caseloads, very small caseloads. I don't think any of our staff ever had more than 15 families. Treating every member of the family as a participant and whose input mattered. treating the family holistically. So, a child who's been living in shelters and then in transitional housing has experienced life in a particular way and might have something to say about changing schools, might have something to say or feelings about moving far away or in a new neighborhood because they made friends in that neighborhood. Children make friends very quickly. So suddenly they go from, oh, we're going to move again? Because they didn't quite understand that. So as a result of that, we used the tenets. One of the tenets was to give a clear message that we were going to be in partnership, and that meant identifying together what their goals were and make them concrete and realistic, and what are the small steps to meet those goals. So let's just say, for instance, housing is a very easy one, and that's what got me exposed to Barb Cordle. So housing makes sense as a focus because there's many of them, education, all kinds of stuff. So as a result of this model, we would sit down, and in the process of the initial engagement, everybody said, I want housing, I need housing. Okay, how do you get that? Some of the people didn't know how to get it. They'd either been in traditional heterosexual relationships, and I do think almost all the people we served, lots of diversity, but I think they were all heterosexual. And many of them were women. Well, they weren't making the arrangements. They didn't know how to do a search necessarily, or what you had to have, and things to say and to possibly omit in an interview, or find somebody to watch your kids. Don't take 6 kids with you to an environment where you're trying to compete with many other families for affordable housing. And if you give any reason for them not to rent to you, they'll pick somebody else. Well, they never thought of that. So we talked through all the things that they wanted to do. So, and then and all the smaller steps. If you call people, how do you have what conversation do you have? Well, do you have a place to rent? Well, I'd like to rent it. There's a way to have that conversation. There's a way to also let the person on the other end of the line get to know you a little bit and make a good impression on them about the things you say. So we taught all that. And then we could come up with a few small task steps, and we would divide them. Here's the ones that you've agreed to do. Here's the ones that will move you and your family towards that goal. Here's the ones that we'll do. Let's make our next appointment. They were still in transitional housing. And let's make our next appointment, and you work on just these. And we'll work on just ours. And when we get together, we'll talk about the progress we made. And that was seen as an indicator of how motivated and how willing they were to work on their own behalf. Because we'll help you. We'll do some of the harder ones. One of the things that is helpful is there's, I don't know when the last time you rented, but it's been a minute since I rented, and at that time in the early 90s, you had to spend money to apply an application fee. You also, and what they spent the money on, the landlords, was getting your credit report and seeing what your rental history had been. Well, some of the people, as a result of part of the reason they were homeless, had to do with domestic violence, and maybe they had left a number of apartments or houses that they were in part of, and they got reported on that credit report or on their housing report. You have to be ready for that. Well, how do you get ready for it? First of all, getting that report, we might get that in their behalf. We might spend the money to get that in their behalf, so they know in advance what they're contending with. It might be $30 for the application. Can you raise $15? We'll kick in the other 15. We want to set them up for success, but you have to do some of it. So that worked very, very well. As a result of that program, we only served, in 5 years, the goal was 105 families. We served every combination of family you can think of. And in that 5 years' time, we did serve 105 families, and not one of them ever returned to homelessness. We had the resources to help people identify where they wanted to live. And my staff helped them look in those neighborhoods, help them with the barriers that might have been preventing them from being able to go to that neighborhood. There were people that had one child. There were women who had one child, and there were men alone raising a child, and they had one child. We had every combination. That program worked very well. Well, as a result, people didn't know all the details about how the day, they didn't know how the sausage was made. Let's just put it that way. So as a result, the community became aware of, there was a program in town where they're helping a lot of people get housing. As a result of that, I got invited to attend a meeting that was on at Doctor's Hospital, and it was I think it was the HIV/AIDS Advisory Committee of Central Ohio or something like that, and the people that were sitting at the table were all the people that were trying to do work in HIV work, and housing was a huge, big need. So I got invited to that meeting. As a result, and I met a lot of people at that meeting, and I started to go to other meetings. As a result, I got to know a bunch of people that were in HIV work that were not social workers necessarily, that were not in case management, that were executive directors or people that worked in various parts of government. And one thing led to another, and I started to develop some relationships with people that were serving that community, and they were serving that community related to housing and specifically related to Pater Noster House. And so one of the people, and I can't remember who it was at the time because that was kind of a long time ago, she asked me to go. She goes, "Are you interested in seeing any of the Pater Noster House?" I go, "Yeah." So there were prior to Pater Noster House evolving, there was a housing effort in Victorian Village that was specific to HIV. I don't remember the name of it. I just heard of it, and I don't think it lasted very long. Well-meaning people, but I don't know what interfered. I have a suspicion that it was the NIMBY. Do you know what NIMBY is? NIMBY is a phenomena in social services, and specifically in the housing part of all different kinds of social services. It stands for Not in My Backyard. And of course, Victorian Village is extremely nice, and it was really developing into a very quaint area. It had been known as Fly Town for the longest because of the meat packing that was done on the river at the turn of the century. and there were a lot of flies there, and it still got called Fly Town for a long time. But Victorian Village, because there's so many nice houses there, I think that was probably what impacted them. And then, so I heard of Barb Cordle and Pater Noster House, but I had no reason professionally to engage with them. Well, I eased in through the back door because I got to know the people on that HIV/AIDS advisory group. So there were 4 houses altogether. I went to 2 of the 4. There was one on a side street in the Hilltop. There was one on West Broad Street, and I went to that one. There was another one on West Broad Street, almost across the street from the one that I went to, that had been a funeral home, and it still looks like a funeral home. And they were there at some point. I never went there. And then they had the last one was Alki Road. And so I went to those. I was beyond stunned. And I had to grow used to the fact that nobody was providing any comfort or support or shelter or food or access to medical, obtaining medical care. And the places that I went, the one that I went to on West Broad was not the preferred environment for people that were extremely ill. And she never said no to anybody. And so many people got kicked out of their apartments, kicked out of their families, kicked out of their houses. So some of the people that got infected were prostitutes. Some of the people that got infected were they were sick with other things. She never said, people were wandering, and there was a lot of homelessness at that time too, that had evolved over the course of the 80s. And so I started in 1992 at Lutheran Social Services, which began my exposure to this. And as a result, and I was there for 5 years. But I had worked for the state health department to help set up the Ryan White Care program. So I wasn't a stranger to these things, but I hadn't been in any of the dwellings. So so I continued my job, and I got to know Barb. And Barb was beyond eccentric. She was quite an interesting and very deeply spiritual woman, very deeply. And she did the best she could to provide service to people that were being ignored. She was completely driven by her faith. She was just trying to live her faith. And as a result, I can't really picture her anywhere but Pater Noster House, because she described and she told me stories about her life before, as I got to know her, long before I was actually one of her funders, representing one of her funders. She told me lots and lots of stories about what her life had been, and she was married to she was married and had children, and I think her husband was dismayed about her commitment to this, and she just felt like she had to do it. She was compelled by her faith to do something because nobody was doing anything. There was nothing for a very, very long time, and there were the city health department did have a relationship with her. And they did go, there were at least 2 nurses I know that went, who are no longer at the health department or in HIV work, and one of them actually is deceased. But they went there and they kept an eye on it. But it was, it's public health and they're nurses. Cleanliness and the way things are done, well, in terms of an environment where people are susceptible to all kinds of germs that will instantly kill them if they have a suppressed immune system. They were upset a lot, and they went to the health commissioner a lot. But Barb persisted, and eventually it would reach the point where the health commissioner would say, he understood. And he said, look, I get this, but it's the only place for anybody to go that's homeless, without a family, without any money, she provides a service to this community. It's not optimal. It could be better. It's gotten better in some ways, but I don't think, I can't do it. And so they never shut them down. It came close a lot of times, but it would finally get to the health commissioner, and with good reason. He saw the whole picture, and I get that. And so as a result of this, when I changed jobs, by then I had a pretty strong relationship with a lot of people that were in HIV work. And as a result of that, I got to know Barb very well. And then the reason I changed jobs was because somebody that I met on that advisory group was a nurse that had moved up. She and another nurse were close friends, and they started at Ohio State at the very beginning of the HIV epidemic, at the very, very beginning, and they were serving in the hospital, and then she changed jobs and went to work for the Columbus Public Health Department, and then she got, I don't know what she started as, but she actually got promoted, and as a result of that, I got to know her, and as a result, she knew that I knew HIV, and I knew housing, and I had connections in the housing community. So in 1997, HUD recognized Columbus as a what's known as a Metropolitan Statistical Area, MSA. And that was Franklin and the 6 counties that touched our borders. That's how they, sometimes at the federal level, that's how they organize, how they collect data, how they provide funding support, etc. And so Columbus was federally recognized as an MSA. Cleveland was already an MSA. But from the point of view specifically of housing opportunities for people with AIDS, HOPWA, HOPWA. That is the acronym. Federal and state governments certainly do like their acronyms. It's a shorthand. And so the nurse from the health department started calling me and leaving messages, started sending me, because it was before, it was really, I think it was before emails. Or we weren't using emails. But she started sending me, every day I get a fax, every day. She's trying to get me to interview because the HOPWA money came to Columbus. And as a result, it was natural for HUD to go to the city that was the central city of an MSA, which was Columbus, in our case, and to go to who was the department in that city that was managing housing money from other areas, the emergency shelter grant. There's a whole bunch of them, and so and that department was at that time, and I think it still is the Department of Development. And they went to the Department of Development and to the mayor, and they said they didn't want it because it was associated with a serious health issue, and I got it secondhand, but they did not want that money to manage. They didn't think that they had the expertise. Well, so the nurse, so that they went to the health department, and that nurse and the health commissioner at that time started talking, and they decided that they'd take it. And that's when she started bombarding me with all of those facts. So one of the things that I wanted to at least touch upon is there have been a number of organizations referenced that were providing all kinds of services, community-based services for people infected. But there were also a couple of organizations that had a narrower focus. And at the time, privately, I always thought they could be doing more than they were doing. They were doing exclusively HIV services work, but the way in which they implemented their services did not seem either inclusive or practical enough that it was providing some of the things that people could have benefited from. And I was frustrated about that, but I wasn't in a position to do much about it. I provided support when it came to my attention from people that were infected, that were seeking those services, but I didn't have any impact directly or in a formal way. But I'd be remiss to not mention both of those programs. They're both non-existent. One of them completely disintegrated, and one of the other ones that was bigger merged with another big services organization, and after that merger, that program slowly eased away and then was no more. And I just wanted to make a nod to that, because at the time they did provide some very important things. One of them, for instance, had washers and dryers that had been donated, and they had a monthly dinner, and people could come and do their laundry free. And that was a very important element. So that would be a small example. But as time went on and the disease changed and there were more resources available and people got slowly housed, it outlived its purpose. So I got recruited to the health department to implement the housing opportunities for people with AIDS. And all the things, and the first thing I did was read the federal law and the statute. That was quite an experience. Unless you had to read something like that, you wouldn't. It's not easy reading, but it was important, because when I was trying to find a way to structure what I needed to do to serve 7 counties, I needed to understand what the categories of service were, and that was very, very outlined in these congressional documents. It said what you could and couldn't do, who you should and shouldn't be served, etc. And when we first started, one of the big services agencies in town at that time was the Columbus AIDS Task Force. They had never received any money for any kind of housing work. Part of that was there was some competition for it, but they were seeing almost the entire population in Franklin County and in some other counties eventually, because they started having offices in other counties that were among the MSA. So they needed access to some of that money. So initially what happened was the money got focused on providing rental assistance to help people obtain and maintain affordable housing based on the HUD definitions of affordability. And there are very specific definitions. And utilizing what's known as the grid that HUD generates for each MSA of what a one bedroom should what the money can be spent on for a 1 bedroom, 2 bedroom, and on up. I think it goes all the way to 7 bedrooms. And what the maximum federal limit is that can be spent on that. And so, and that was a challenge because some of the people needed housing had children, and they couldn't afford. They weren't eligible for what was available for bigger units. And so that made it especially challenging. But we eventually were able to find a way to work around that. And slowly but surely, people got services and access to services, if not in the actual county itself, but access to financial services to help them with the first month's rent, with a deposit, with the application fees, etc. So eventually we were able to help a lot of people in a lot of different locations. And it started to run so well that HUD actually came. I went to an enormous number of national meetings because it was a new thing all over the country. So I went to meetings in DC, I went to meetings in Los Angeles, I went to meetings in Atlanta to meet colleagues that were overseeing and managing and distributing this same amount of money by the same criterion. There were programs in Cleveland that their MSA in that the counties that are part of Cleveland were managing, that they had their own money. And eventually Cincinnati was also in that position. So I knew all the people in Ohio that were managing that money, and I eventually met all the people that were utilizing the money. I saw many wonderful programs all over the state of Ohio that had been funded by HOPA money. And I knew the people that were overseeing that money and the people that were implementing it every day. And we have nothing to be ashamed of. In fact, we have a lot to be proud of, both because of our Ryan White structure and the way we decided to do services, which is still running, as I said before, and the way we manage that HOPA money. And that's still being allocated. So how I got to know Barb on a much more formal basis is we began, the health department began to fund the Pater Noster House. It was one of the categories that was eligible for funding. And so as a result, I was in a much different role with her. I was in a role where I had to spend time out there. I had to keep track of what was going on in a basic day-to-day basis. And some of the things that went on, I anticipated it because of earlier experiences when I was exposed to Pater Noster House and to Barb's work. And they were serving a lot more people out there. It was a big property on Alcar. There was a huge barn in the back of it, and it was a big white farm house on a lot of property. I didn't ask too many questions about how they got the property, but that farm, one of the things that went on related to that I discovered, that farm had been, that barn had been a chicken barn, and there was an enormous amount of chicken feces on the floor of that barn. And they were utilizing the barn for, not for housing, but for meetings. and for events, etc. And I had no choice. I had to have that barn cleaned. I don't think we paid for it with HOPA money, but a lot of people in the community always came forward if there was ever any need that Pater Noster had. And people, it happened. It got done. I wasn't there when it got done, but the last time I saw it, it was very nice. It was clean. It was a usable space. That was one example. Barb worked so hard every day to provide so many things for people. There was a big room on the second floor of that building, and a number of people shared that room. And that seemed to work out well. There was a room on the first floor, and sometimes there were really, really sick people in that room that they kind of needed to have a more of a private space. That evolved over time, and eventually that wasn't being properly used after Barb was gone. But she used common sense about that. She had some interesting ways of raising funds. She came up with some very clever ideas. It wasn't necessarily good for all the people that lived in the building. For instance, I remember when I think she was keeping the chickens, and there was a stand in front of the house to sell eggs. And when people would go by, there was a big sign in the yard, and there was a big driveway. There was a lot of room for a lot of cars in that driveway. She had a big sign, and she was selling eggs. No, it's not good to have chickens. Very, very prone to creating infections. She also bred and sold puppies. And the puppies were running all over the house. They were cute little dogs. But, you know, when there's a house full of people and everybody feels connected to, like, puppies, nobody feels responsible for taking care of the puppies, and I only ever saw them in the house. So, you know, you can guess what else was in the house as a result. I had to interfere with that too. You know, it sort of broke my heart because I know she always meant well, and she did what was available to her. And there's a very famous story in this area about because she had a very big relationship with the Columbus AIDS Task Force. And there's a very well-known story about one of the Columbus AIDS Task Force folks lived in that area and often passed her facility on his way to work. And evidently, and I remember seeing this stuff, people would drop off things, and also very well-meaning. The community, the people that were involved in that work, and from one end of the spectrum to the other, were always happy to have people that were caring and interested and who meant well. But sometimes it created more problems. For instance, I know that the AIDS Task Force had at least one, maybe two storage units of things that people brought to them to donate. And I'm like, so I know that one of those units had a lot of medical equipment, walkers, bedside commodes, bedpan, all kinds of stuff that people who are very ill, who are being cared for at home, need. And as a result, they offered, among other things they did with the stuff, I don't know what all they did, you'll have to ask Gloria Smith, but I know that they offered that to Pater Noster House, and Barb said yes. So the arrangements were made, and they brought this stuff. And a few days later, one of the people that works at that worked at CATF was driving into work, and they had a massive yard sale going on in the front of the building on their lawn, selling that stuff. It was all used. It was all used by people who had HIV. We don't know if it was clean. We don't know if it had been sterilized. And there was the only way to buy it would be to pull in the driveway. Well, you might pull in the driveway and two other people come and they block you in. I mean, it was just not a suitable activity. But she was very creative. And of course, the drag queens, God love the drag queens. They had so many events for her, so many. And the community in general, when I say that, I mean the people that were involved as volunteers, and there was an army of volunteers in the Columbus area, as well as anybody from the funder level, which I represented as one member, all the way to anybody that did any work with the people that were infected, either in housing or in services. We had events. We had a massive holiday event every year, and all kinds of. We had at one time in Vets Memorial, and everybody got presents. Lots of presents. It was really a very big deal, and people like to be involved in it. The Gay Men's Chorus came and sang. I can't remember all the other things. There was I know there were lots of nice things. TVs, all kinds of stuff got donated, and people got lottery tickets. And they'd pull tickets, and whoever had that ticket could get the next thing that was available as one of the gifts, and they were nice things. We treated the people infected as members of our shared community, and I'm very proud of how we treated them. And then as the years went by, the Columbus Public Health has a huge room that is used for all kinds of events and big meetings and big meetings that are community meetings that have nothing to do with HIV, that are trainings. I mean, all kinds of people have met in there, and we started to have those holiday gatherings in there. There's currently a bingo game. There used to be a bingo game that ran in there. It's smaller now, so it's down to one of the other rooms down on the first floor. But that room got used for a lot of things, and we always tried to make sure all the people that were at Pater Noster House were included. She was a very unique and eccentric individual, but she truly a heart of gold, and everything she did was faith-driven. When she finally retired, I was happy for her and moved to a warm place in the South. She deserved that. She sacrificed a lot. I was happy to be involved in making funds available to her. She was providing a very needed service in this community. The way it evolved after she was gone is a whole nother matter. And I was still at the Columbus Public Health at that time, but I had moved up, and I was supervising a team called the HIV Initiatives program team. And I hired a social work colleague when I moved up, and she worked for me. And then when she moved on, they promoted another person that had been on the team, and that was the last I was aware of. The things I remember about the services provided was an enormous exposure to absolute goodness, so much kindness and goodness. And I was very, very proud that HUD came here, and Columbus Public Health was awarded a plaque from HUD for the work that we'd done specifically related to housing. Because I instinctively had some ideas. I thought, well, this makes sense to me. I guess if it doesn't make sense, because there was no blueprint. If it doesn't make sense, I guess somebody will tell me. And when they came and did an audit, they were very pleased what they saw, and we eventually got an award. And I was proud of that. And I look back very fondly on that era of my HIV work. And I certainly look fondly back on the teaching time I did at Ohio State related to HIV. Specifically, I taught other things, but I certainly liked that so much. It was a privilege. Those young people knew nothing about it. And it wasn't unusual because of the material we talked about, some of the videos we showed. Now, eventually, it was available and they could do it. We eventually went offline. We stopped going in the classroom. We taught online. But the whole time myself and Dr. Randy Love were teaching it, we would do all the things in the classroom. And when the lights would go out and we show some of these videos, we could hear people crying all over the room. And people would, when the lights would come on, I always had a box of Kleenex. I'm sure Randy did too. And we'd process it a little bit. And I remember one time, I asked anybody if they had anything they wanted to say. And a woman from Cameroon, very, very dignified woman, stood up. And she said she was from Cameroon. And she told a story about her sister who had been educated in Great Britain, who was an attorney, who got infected and came back to Cameroon to seek family support. And there was something in Cameroon at that, and she was struggling to tell this story, but she wanted to tell it. Cameroon is one of the places in Africa that was often mentioned, connected to HIV. And she wanted to tell this story, and I'm like, okay. She tells that her sister came back and she begged her sister to go back to Great Britain, and she wanted to be among her family. And one thing led to another, and at that time, and that's been a while, Cameroon had something called prayer camps for people that were infected with HIV. And her sister took herself to that prayer camp, and she begged her sister, please don't go there, because the concept was, as this woman shared with the class, you have to go there and you have to pray, and you have to pray constantly all day, every day, and for healing and health. And nobody that ever went in there ever came out. They all died. Because, of course, prayer wasn't not the only answer. And it was important to her to tell that, how far we've come from the beginning. And I never forgot that story. I ran into that woman after she had her master's degree in a location where she was doing intakes on the weekends, and one of my relatives was her somebody that she was working with. I went to see my relative, and she answered the door. I couldn't have been any more surprised. It was delightful. She embraced me and she told me all about her career, and she remembered that day too. So that's kind of how I want to end. We don't know when we do things how it will lead to other things, who we will touch later, how they will touch us. It's all a big cycle. And if you live in a community long enough, my belief is that we will have many interesting and important things happen. to us, and we will have things that we make happen that help other people that are interesting and important. And I've been very proud to be part of this community.